Everybody, guess what? We are live. It's Mayor Ken Moore with us today. How are you? It's like mid-morning, almost noon, right?
Almost lunchtime, and I've been revving up for another Zoom call or whatever these calls are. It's been my whole morning. Started at 7:30, and here we are a little later in the morning, and uh, it's a new way to work.
I know. Well, I appreciate you taking time out to talk to me. I know you've been really busy. Last time we talked, things were not open. And now we've got restaurants open at 50%. Some other things are starting to open. Can you tell me what that looks like right now for Franklin?
Well, you look at Main Street, and you're starting to see a lot of people come back to Main Street in downtown Franklin, and I understand a lot of the restaurants out in the Cool Springs area have been busy. To me, this is the most worrisome portion of the whole pandemic because people are letting their guard down. They're getting relaxed. They're a little stir crazy because they've been staying at home for so long.
Yeah.
So I would caution people that they need to continue social distancing. They need to do all those things we've been talking about all the time. This is not over. We're doing really well. Thank you, Franklin. Williamson County, for how well you're doing. We just had 2 reported cases yesterday, 0 on Saturday. These are good signs, but I'm worried about the numbers ticking up as we go forward and this infection rate going up. So be careful, be safe, follow all those guidelines that we've talked about again and again. And I would ask that if you're going in a business to shop, please be respectful. Take a mask and wear a mask. You'll see most businesses, their employees are wearing masks now. Uh, you know, there are people that say negative things about the mask, and how effective is that? But there is some effectiveness to it, according to the CDC, and we're trying to get rid of this pandemic. So let's all do our part wearing the mask.
Yeah, that's great advice. Tell me about this, just launched today. Find Hope Franklin. The month of May is mental health awareness, and this initiative just launched officially today. Is that correct?
Well, it actually officially launched last week, just a little bit, and we launched it early because of the pandemic and the anxiety and stress that's going on um, with the pandemic. Originally, I'd hoped to roll it out with my state of the city, and so many things have changed. Find Hope Franklin actually started a little over a year ago. Conversations about we were doing a good job on community health. We were targeting obesity, activity, tobacco cessation, mental health. A lot of conversation about all those except mental health, and we had some discussions, and I sat down with Marianne Schroer, who at that time was executive director for CASA, and we talked about what a blue ribbon panel might look like to look into mental health and find some direction. So that panel came together and was facilitated for 4 meetings by Gary Miner, trying to figure out exactly what direction we wanted to go. The first direction was to make sure that we were all on the same page and we could narrow the scope of what we were doing. So we identified that we needed to clarify what the resources were that were available to the public, that were usable and findable. Then secondly, put them on a website that we've created, findhopefranklin.com. Third, we identified the need for to attack the prevalence of suicide in our community. We hear a lot about CPR training.
Yeah.
Everybody should be trained in CPR. Well, I think everybody should be trained in suicide prevention, and that's called QPR, question, persuade, and refer. And so the 13th and the 20th, we're going to be having sessions in association with the Tennessee Suicide Prevention Network and Franklin Tomorrow to start to train our community. These will be virtual trainings. It's about a 90-minute session. But our long-term goal is to use a grant that Franklin Tomorrow obtained through Vanderbilt University and train QPR trainers. This is a full day course, and then we would take those 20 or so trainers and then disperse them out in the community to talk to civic groups, church groups, whoever wants to come together and learn about QPR training. So I'd like for our community to be as well trained in QPR as they are in CPR.
Yeah, that's the first time I've heard the phrase QPR. I like that. And
Yeah.
I like also that we're bringing this conversation to the forefront because I feel like for so long we have not talked about it.
Well, we don't know how to talk about it. And I found that out by, some of my experiences. I ran into a friend at an event. There'd been a suicide in his family. And the first thing I wanted to do was go the other direction, but that didn't happen. And I found that he wanted to talk about it. And I think that's therapeutic to a lot of people, is the ability to sit down and talk about it and unload some of their pain and anxiety and anger, whatever it may be. One other thing I didn't finish up and mention was that we found in our community we have a lot of resources, but we don't have enough resources for mental health. We found that when someone has a mental health crisis in our community, usually the person that responds is the police. And the police have two choices. They can take them to the emergency room, where I found out that in the emergency room they may stay sometimes 2 or 3 days, or they take them to jail. If you can imagine, if you're having a mental health crisis and you're in the back of a police car, that's probably not the best place to be at that time. So long term, we need to identify some type of facility that would be able to offer a continuum of care for folks in a mental health crisis. So part of the panel will be studying that going forward, and that's a long-term goal that we investigate that.
Yeah, I saw that on the information about this, that you're looking for a short-term care facility to offer to our residents.
Well, you say short term. I think more of an acute care facility where someone could be taken there, number one, rather than going to jail or sitting in the emergency room. And from there, professionals would be able to deal with this particular person and then get them into a continuum of care for whatever their mental health crisis may be.
Well, I think it's an incredible thing. I'm glad that the city is tackling that. Not an easy task, as you said, even really to discuss. It's difficult, but I'm glad that we're taking a look at that. Tell us again where we can find more information for those who are interested.
I would go to the website, findhopefranklin.com. That'll be the easiest place to find and follow. It's got some unique things in there. Number one, it's the website is in rough, it's not polished yet, but the resources that we've identified are there. One that I think is very good is text Williamson 741-741. That puts you in a contact with somebody that can text with you and get you into a resource that you could utilize for whatever situation you may be in. There's another good link there that where you can do your own mental health evaluation. That sounds scary, but it's a series of questions, and then at the end it would give you some resources that you could go to. Of course, there's always crisis lines that you can call. There's the Suicide Prevention Network. So a lot of those resources are listed on this website, and I've had a great team to work with, and there's still a lot of enthusiasm about this to attack this problem.
Yeah, yeah. Well, I appreciate you taking time out. I know like you mentioned earlier, you've got a day packed full of calls just like this. So we're so glad you took time out for us and give us a little update about what's going on and the new things that are happening in the city. So thank you for working hard every day.
My pleasure, and I'll just have to tell you that this was my favorite call. How's that?
Oh, I love it. I'll take it. I'll take it.
Thank
All
you,
right.
Donna.
Well, we will talk to you again soon. We'll get another update maybe in a couple of weeks and see how things are going.
That'd be great. Look
All right.
forward to it. Bye bye.
Thank you. Bye bye.